Hi, everyone. Welcome back to this episode of Family in Focus, a radio show brought to you weekly every Monday right here on PHLV Radio, presented by the Asian Community Development Council. And we talk about different issues and topics affecting the AAPI community and beyond here in Nevada. And today we're going to be talking about a very important issue, a very timely issue that a lot of people are trying to get more information, I'm very interested about, which is the COVID-19 vaccination. As you know, it has begun here in Nevada and around the world. And today I wanted to bring in two experts who have really been involved in this world here locally, and they have some great information to share. First, I have Dr. Marife Aczon-Armstrong, who's the founder and current president of the Asian American Pacific Islander Nursing Association of Nevada. She is also the assistant professor at Roseman University College of Nursing. Also, I have with me today Dr. Chrsitina Madison, who is the founder, CEO of the Public Health Pharmacist. She's also at Roseman University. She's associate professor of pharmacy, and she's been a frequent media contributor when it comes to the issue of public health, and especially now, I think more than ever, the issue of COVID-19 and the vaccination process is at the top of mind for so many people. So thank you so much to both Dr. Marife and Dr. Chrsitina for joining me on the program today. Dr. Chrsitina, I'm going to start with you with this conversation. I know you've been very active on social media, on all your pages, giving us the latest information when it comes to the vaccination process and what people need to know. So I know there's some big headlines. So what's the latest that we need to know right now? I know we've been hearing about a different strain that's coming out overseas, and we're people are interested about this. We want to know, we're going to get the vaccination at some point, that it's going to work.
Yeah, so excellent question. Thank you so much again for asking me to be on today, Patranya. I think you and I have probably, of all of my amazing female entrepreneurial partnerships this year, I think you and I have really had an opportunity to work really well together. And I can't thank you enough for that. And obviously, my dedication and love for the API community, working with ACDC, trying to get flu vaccines out to those in the community. So as far as the latest right now, we are seeing reports coming out of the United Kingdom about this new variant of COVID-19. One thing I do want the listeners to understand is that viruses commonly mutate. So this isn't something that is, of a shock or something that we, didn't expect to happen. I think the thing that is of most concern, though, and why we're seeing it really catch fire in the media right now is the fact that this particular variant of COVID-19 or SARS-CoV-2, which is the virus that causes COVID-19 disease, is that it's more transmissible. So these, public health measures that we've been implementing, like social distancing and mask wearing and hand washing, there's the concern that because this particular virus is spreading so quickly that 6 feet apart maybe isn't enough, and that it could spread widely to other countries. And so we're seeing borders being shut down, travel restrictions being implemented for those who are living in the UK. And so I think that's really where we're at right now. There really isn't any evidence yet that even though this is more transmittable, meaning that you can get it quicker and that it is rapidly multiplying, that it doesn't look like as of right now that the disease that you get from this particular variant is more severe. But that is the concern moving forward. As far as the vaccine goes, at this point, there's no evidence to suspect that the vaccine wouldn't work on this particular variant. But as I mentioned before, this is an evolving story and is rapidly changing. And so it's probably going to take us several weeks to really ascertain whether or not this variant does potentially pose another type of a threat to our current vaccine efforts.
And, talking about vaccination efforts, you've been out there, as you said, Dr. Chrsitina, about, getting people to get their flu shots. And, there've been people who, even with flu shots that have been around for a very long time, who've been kind of adamant about not getting the flu shot, which is something you're trying to work against, obviously. But when it comes to the COVID-19 vaccinations, there's still so many questions, right? Because, how fast it came out, the effects that it would have on people. So give us kind of the basic thing things. What do people need to know about right now, about where are we here in Nevada, where the process is? I know people are starting to get vaccinations here already, right, in the state.
Absolutely. So we actually received our first shipment of about 17,000 doses of the Pfizer vaccine, which is the messenger RNA vaccine, last Monday. And we've vaccinated thousands of healthcare workers since last Monday. And we're very patiently awaiting the arrival of the Moderna product because it was approved by the FDA for emergency use authorization on Friday. So that should be arriving very shortly here in Nevada. And we should be able to start allocating those doses to the first tier group, which is healthcare workers and long-term care facilities. Unfortunately, we do know that our shipment that was originally allocated for this week of the Pfizer product, unfortunately, was decreased by about 40%. Some of the information that's been coming out of Project Warp Speed, which they actually just had a press conference this morning, was that allocation miscommunication is most likely going to be corrected within the next week or so. So the doses that were originally promised, hopefully we will be getting the amount that we order moving forward, because that will put us behind as far as being able to vaccinate the next tier group, which ACIP is identified as individuals greater than the age of 75, as well as essential workers. So that's really where we're at right now within Nevada. And the Southern Nevada Health District is working diligently to try to get those, not only the vaccine, but the supplies in order to administer the vaccine out to agencies that are going to be able to vaccinate the public when it becomes their time to get vaccinated.
Right. And, you know, I wanted to bring also, I want to hear from what you want to say about, you know, the impact and the reaction so far. But let me bring Dr. Marife into the conversation here, because we were talking right before we got on this call here, Dr. Marife, that you have worked in healthcare settings all over the country, and you've been talking to your colleagues in hospitals and clinics all over the country who've been getting the vaccines. Tell me about the reaction so far, you know, both, I mean, I'm sure there are people who are very excited to get it, but also their physical reaction after getting these vaccination.
Yes, I work at the Queen's Medical Center in Honolulu, and they are the only trauma and I forgot the name of their the prestige hospital there. They also received their shipment about the same time as Nevada. I believe the University Medical Center is the one who is in charge of the first shipment. So when I heard about the Queen's Medical Center, I do have a lot of still friends who are working, who are frontliners there. And the first thing, a couple of them, the first thing they said is, you know, the usual reaction when a foreign substance is introduced to the body, slight fever. And of course, because it's an invasive procedure where it's going to have to pierce in our barrier skin, there's redness and swelling. Some said they have dizziness, lightheadedness, and sometimes stomach problems. But then again, we don't know if it is really from the vaccines, or maybe, you know, it depends upon the individual. And so earlier we were talking about people who shouldn't get it. Those people who are already having to carry their epinephrine shots, which means that they are already allergic to something, and that protects them from any exposure to the allergens that's allergic from. And I know that so far none of my friends have the reactions such as anaphylactic shock, where they already are having a hard time with their airway. You know, there's the obstruction in their airway. So far, none of my friends from New York who had gotten them, none of my friends from Hawaii had said that they had that problem. So it's very promising. And I think that tonight we're going to talk about it on my other radio show about those individuals who shouldn't get it. So far, the people that I know from the Midwest also, they are showing, you know, they have the stickers that said, I got a COVID-19 shot. And some areas also had their, pins that they can wear. So I think that a lot of people out there are wondering, like, what's going to happen. How do we know if these vaccines are going to work? And I don't want to take it because I want to wait what happens to them. So I think that's the dilemma that we have, even among the healthcare providers. They're also worried about themselves. If not about themselves, would be their family members. Is this really going to, even though we know science, this is supposed to help me, but as human beings, we always question ourselves, like, is it really going to help me? And if it's not going to help me, it might make it worse. Like, you're introducing something that might get me sick. So I think this is an opportunity. So thank you for inviting me, Patranya, to be part of this information that we're giving to the community. I think educating the community, both healthcare workers and non-healthcare workers, about vaccination is very important.
And I think you bring an interesting perspective to this conversation too, Dr. Marife, because you were born and raised in the Philippines. I was born and raised in Thailand, and I feel like there's a different perspective there. We were talking about the cultural, perspective when talk about vaccination, right? For us growing up in Asia, I felt like that was just kind of the way of life. Everybody gets vaccinated. There's really not much of a cultural pushback, where I feel in the Western world, sometimes we see more of that when it comes to vaccination. So this must be interesting to see, especially, do you see differences between maybe healthcare professionals of Asian American descent and others when it comes to the excitement of getting this vaccination, or any kind of pushback or anything like that?
Absolutely. We were talking stories earlier where I got my vaccination when I was in elementary school. I went to a public school, and I remember being lined up. We were all lined up one by one in one line, and there's this nurse who had the vaccine, and we're just like one at a time. It's just like a factory. So I think in our minds, we trust the people who are giving us the vaccination, that it's supposed to be good for us. So if you see someone who was born and raised in the Philippines, you will have like a scar over here. We call it bakuna. Those who are Filipinos out there, the vaccination, we call it bakuna, and said, did you have your bakuna in the Philippines? And then we'll all show off our arms. So I think, there's this culture where we came from a culture where, okay, the Americans are here and they're going to help us be well and be healthy. And so we gladly accept that because we trust them. There's an extreme now that we hear about, those what we call anti-vaxxers, where they are very resistant in getting the vaccination. So you'll see even in the benefits of the vaccines, and those who shouldn't get it, that's why you're asked if you are, have a fever, or if you have comorbidities, like any medical condition that might put you on a higher risk of having a severe reaction to the vaccination. But culture is really a big part of this acceptance of being vaccinated, not only with the healthcare workers, but also with our community at large. Even the flu vaccine, we are having hard time, people coming in, we have it available for them, the drive-up clinic, pop-up clinic. Dr. Chrsitina, I know, is very involved with the pop-up clinic. And I know Patranya and I were talking about earlier that the numbers are going down. I wonder why, Dr. Chrsitina, why is the number of the people who are getting flu shots are going down? I wonder.
Yeah, no, it's a great question. I think that, there's multiple factors. I do agree that vaccine hesitancy, as well as, what the WHO, claimed last year, was what we call an infodemic. So it's a tsunami of misinformation and facts. And unfortunately, because people are getting their news and consuming their news and information from multiple points, like, social media, and from their social groups, and from their families and their friends, it's really hard sometimes to decide, do I go with what my family or my friend tells me, or is it more accurate for me to try to do my own research and look for that evidence-based medicine? And I think that's something that I really try to promote, in particular on my social media pages, is, I reference everything I post, everything on my social media has a resource link so that people can look at the underlying information themselves and they can make their own determination. I try to summarize those facts, but I always make sure that I provide the source material so that people can go back to that. Because again, I think that because there is so much misinformation out there, it's really hard to find that trusted voice and be able to really what I like to consider to be that, beacon of hope and light in the world, and try to make sense of the craziness that really has been 2020. So, I agree wholeheartedly with all of your comments and want to just echo, it's not just the Asian Pacific Islander community, but it's all of our minority communities that are having challenges with, acceptance of this vaccine. I mean, I don't think that it was a mistake or a accident that the very first person that they had on television that was being vaccinated last week was not only an African-American woman, but then the person vaccinating them was also African-American. So I think that was very purposeful because they want people to see that ethnic groups are accepting of the vaccine. And you do see that there is more of an uptick in those areas when people are seeing themselves getting vaccinated, or that someone that looks and sounds like them is accepting of the vaccine. So I think it's going to take all of us together to really advocate for the safety and efficacy of this vaccine. And again, going back to Patranya's point about the information and who's providing the information, this vaccination has had more scrutiny than pretty much any vaccination we've seen in history. Not to mention the fact that although it was perceived to be done quicker, the research on SARS vaccine started 17 years ago. And remember, this virus is called SARS-CoV-2. It's about 80% genetically similar to SARS that we saw 17 years ago. So this work has already started a long time ago, and we really just benefited from the massive amount of funding in addition to the public and private partnerships to really, as a globe, work on getting this vaccine out in order to try to end this pandemic as soon as possible. So I think that we're in an exciting time right now. And, I've already told a lot of the local news stations that as soon as I'm eligible to get the vaccine, they can all show up and video me getting it. So
hey, I'll be right there with you. Yeah, me too. And I think that's what's been really interesting, just hearing different perspectives from not just medical professionals, but my own friends and family when it comes to the COVID-19 vaccines, whether or not you're going to get it. And I heard a great quote earlier about how, when it comes to protecting public health, protecting the community, it's not the vaccines that matter, but vaccination, right? Even though we have the vaccines out there, no matter how effective they are, if people don't get vaccinated, that's not going to make a difference. So I think, what, Chrsitina, your work getting out there to the community, especially with the free flu clinics that you've been doing this year, I think that's just been so important. And I think, right now, people just want to get as much information, as Dr. Marife was saying, that education is so important, especially education through different platforms, right? In different languages. I know Dr. Marife, both in Tagalog and in English. Dr. Chrsitina has been going out to different communities and just building that trust when it comes to what this vaccine means to the community. So Dr. Chrsitina, any word in terms of, I know we've been hearing when the vaccines could be available more widespread to the public. I'm hearing spring, summer. What are you hearing from your sources this morning?
Yeah, so as of right now, I think we're still pretty much on track to have vaccine available to the general public. So for all people who want to be vaccinated, vaccine will be available to them, most likely late spring, early summer. So it still looks like we're on track to meet that deliverable. I will tell you that in addition to the two messenger RNA vaccine products, so the Pfizer product and the Moderna product, we also have a product that is a more traditional vaccine, which uses a modified viral vector or an adenovirus to get the vaccine. And that's from AstraZeneca. So that product is looking like it will most likely have its phase 3 data released sometime in January. And if that's the case, we could potentially have an additional vaccination approved at the very early portion of 2021. And then we also have the Johnson & Johnson vaccine that's looking very promising as well. And the difference with that particular vaccine is that it would be only 1 dose versus 2 doses. So that might be a game changer, which would really help to expand the vaccine supply, because if we can go from having just, having 2 doses to only needing 1, that means that your vaccine goes a lot farther and you can get a lot more people immunized. So
that's right.
Those are all very promising.
And I think that that's the key, is not just one vaccine. I think most of these are all not, you have to get 2 doses, right, for it to work. And I know there's so many, so much we still need to kind of figure out of how we're going to get people to get their second doses, and, when children can get them, so I know, Chrsitina, you'll be talking about this issue for many, many months moving forward. And Dr. Marife, I know you have a radio show here on PHLV radio as well, talking about health every Monday. So what are you hearing, especially from the Filipino community, when it comes to these vaccinations? And what are they telling you? What are their concerns? Are they more excited or more scared? Or what are you hearing from this community so far?
I think I'm going to start with a positive first. A lot of my friends from the Philippines, because our advanced technology is so amazing that we can connect with my kababayans and my kababata from the Philippines, my childhood friends. And I was telling them, what a great Christmas gift for us to have this new COVID-19 vaccines. It's so timely. We wanted to say goodbye to the year 2020. Here comes 2021. Please get us ready. So my son is graduating from high school, and I want him to walk on the stage. So I don't want to be have a virtual. The virtual is okay too, to celebrate, but that was taken away from them. To have the face-to-face. So I think that the vaccine itself is a miracle that we consider. It is a best Christmas gift ever for us. And so I think if we spread it around that it's a best Christmas gift ever, they will get excited with it too. Sometimes with the emotions, we can get people excited and have them understand that this is truly something that's a gift, so we can move on and say goodbye to COVID-19 in 2021. So as a lot of people talks about the vaccine, I think that there's one, I wanted to say just a little story on Facebook. Someone posted a video, and it's talking about the ingredients of the vaccine. And they say that there is and I wanted to get it out there and be transparent. And the video said that the ingredients include a 14-week-old aborted fetus. And so I posted and I said, please research information that is showing in the internet. Make sure that it's credible. When we get our surgery, we have second opinion, right? So don't just take it at face value, especially our kababayans there who just came from the Philippines, from the province, and you just go on the internet and just get the first information. Please research. It's in the tip of your fingers that you can verify. And I know Dr. Chrsitina talked about it, that when she posts anything, she put in references or where the information are coming from. So for our API population, our ethnic minority population, research, ask someone that you trust. Don't just believe it just because it's posted on Facebook or Instagram. So
and I think that's why, it's so great to have you, Dr. Marife, and Dr. Chrsitina, because you are, you represent, of course, the ethnic minority population, but also trusted voice in this, right? Dr. Chrsitina, I mean, you've been talking to the media about this issue since the beginning. I mean, we've been talking since, most of us had no idea. And this is just the beginning of the year. I mean, this has just moved so fast. It's hard to believe how much things have changed in the past 7 or 8 months on what you were talking about then and what you're talking about now. So things are moving so quickly. But as Dr. Marife said, it's so important to seek out trusted information, especially from medical experts when it comes to this issue.
I just wanted to make one quick little point in regards to the comment about the fetal tissue. So the Pope actually came out with a statement today about the potential for the development of the vaccine. If it did, for some reason, have some cells that were derived from any kind of fetal tissue, that they are looking at that as, from a public health standpoint, they are saying that that is ethically okay. So I think that's really huge for those of us who work in public health. When you see the Pope coming out with a public statement regarding a vaccination, and especially because there have been these, reports about they potentially used cells from, fetal tissue. So I would definitely let your friend, whoever posted that, know that they should be looking at what the Pope is saying, and that we should be able to trust the Pope. So.
Yeah, it's so interesting. Yeah, because, it comes to people are thinking about not just medical, but their own personal beliefs, right? When it comes to vaccines and vaccination. And that's what's so difficult, because this, you can't deny the fact that COVID-19 has sickened and killed so many people around the world. And there needs to be a solution. And it looks like the solution is here. It's just a matter of when we can get it out there. So Dr. Chrsitina, looking forward, into 2021, what are you seeing right now? And what can we look forward to? What should people be prepared for when it comes to, getting this vaccination?
So I would say information is really key, and making sure that you're staying up to date and informed. And the other part of this too is that we all really have to stay vigilant and making sure that we're doing the public health interventions in order to stop the spread of the virus until we can get the majority of the population vaccinated, because we're really not going to be able to get to any semblance of normalcy until we can get to that herd immunity, which isn't going to be until we get about 70% of individuals, and that's really the bare minimum, either vaccinated or immune due to infection. And obviously, because COVID-19 is so deadly, we don't want a bunch of people getting infected and then potentially overwhelming our healthcare system. So the key here is, if it is your time and you are part of one of those priority groups, don't wait to get vaccinated, because if you wait and it's your turn, we're going to just delay this pandemic. And so the soon as you can get vaccinated, and you can look to see where you're at in that tiered priority section. So Nevada has a COVID-19 vaccine playbook. You can access that at the government website, and you can see where you're at within that allocation for the tiers. Find out where you're located, and as soon as you're indicated that get the vaccine, please make sure that you get vaccinated, and not just get vaccinated, but make sure that if you do get one of the products that require 2 doses, that you go back for your second dose. So those were those are really the big things that I would say, is just make sure that you're staying up to date, make sure that you're always wearing your mask, you're washing your hands, and you're doing social distancing, because those things not only help us from COVID-19, it also helps with the flu and common viruses. And so all of these things are just good public health practices, just in general, as well as slowing the spread of COVID-19.
And Dr. Marife, I'm sure you agree with what Dr. Chrsitina had to say. Any final word from you? I know you are active with the Nursing Association here in Nevada, also at Roseman University. What are your final thoughts moving into 2021?
I echo Dr. Chrsitina about getting vaccinated when it's your turn. And don't forget, just because you got vaccinated doesn't mean you just throw the mask and not wash your hands and then hug everybody. So, Filipino, the culture, the Asian, and I'm sure all ethnic minority group, and everybody wants to be around people. Humans are created to socialize. Humans are created to love one another, but not right now. We have to take care of this COVID-19 go away. So I think that the most important thing is get vaccinated, keep the CDC guidelines, wear your mask, wash your hands, just like Dr. Chrsitina is saying, do physical distancing. I like to say physical distancing rather than social distancing, because we still can socialize like what we are right now. We're socializing. So right, I think that really wholeheartedly, this vaccine, this COVID-19 vaccine, is a Christmas gift. It's an early Christmas gift for all of us. So receive that Christmas gift when it is given to you.
That's right.
Even if it's belated.
Yes, I'll take it. I'll take it. Hey, my birthday is in April. So if I can get it as a birthday present, I'll take it. I can wait till then. But, it is really a gift, I think, for so many people, just to give that hope, right? I think if anything, we want the hope that this is the beginning of the end of this pandemic. And we hope that that will come sooner than later, that we can go back to kind of a normal life soon. But as you heard from both Dr. Marife and Dr. Chrsitina, that it's so important that we're still learning so much about this vaccine, but just still stay safe and, wear your mask and follow all those health guidelines, and also follow all the great, medical information coming from both these doctors as well. So again, Chrsitina and Marife, thank you so much for joining us on the show today and giving us this much needed information, and also lots of hope for people listening right now and wanting the world to be normal. I know I want to as well. So thank you so much for joining us today. We'll put some more information on both the doctors on this Facebook page. If you want to follow us here, also on ACDC and PHLV Radio, join us every Monday at noon. And we hope you stay safe and well. And we'll see you on our final episode of the year 2020 coming up next Monday. Have a great day.